My original name is Dorothy Jean Hurst. Then when I was married, I was Dorothy Jean Hurst Worley. And so, but everybody in St. Francis knows me as Dottie. At the hospital, I wore many shoes. I started in the OR at the old hospital. I was a staff nurse as we moved out here to the new hospital. And I took on more of an education role and teaching. I had students that scrubbed in with me and they learned how to do things. And then I moved into management about 10 years after I started. And then I became the director of surgical services. There was a need for somebody to be over construction because we were getting ready to expand the OR. I wrote up a proposal for a position to be in charge of being a project director. And administration only gave me a temporary one. So I took that position thinking that my role was going to be over when the OR was finished. And then I moved on to radiology, the restaurant, the heart hospital, the cancer, and then the tower. That was it was an 11-year temporary position. I am most proud of the healthcare facility that we have built for our community and our patients. Even moving to the new hospital, that didn't answer all our needs. We have expanded and kept our growth to meet whatever opportunities there were. The technology. St. Francis was very into staying with the state-of-the-art equipment and, of course, services, because we added so many services that from the old hospital, we only had general orthopedics, ENT, and GU and I. Everything else got added out here. That made me very proud of what we had done. And I had the opportunity to go to the Association of Operating Room Nurses when I was director every year. And at that meeting, you learn about new things being done, new equipment, safety measures, infection control, just anything related to the operating room. I always came home feeling we were on top of things. It was really a sense of pride. You know, I started off as a staff nurse. I had maybe a 15-minute, but I don't believe it was. I think it was 10. I came into the St. Francis and I thought I was meeting with Sister Dorothy. All of a sudden they said, Sister Virgilia is going to be seeing you. I went in Sister Virgilia's office. I told her that I had been corresponding and I was looking for a position on a surgical floor because that's where my experience had been. And Sister Virgilia said to me, how would you like the operating room? And I said, oh, Sister, I don't have operating room experience. I've been working on a surgical floor. And she said, how much did you have in nursing school? And I said, I had 3 months. She said, that's all you need. You start in the morning. There was no discussion of pay. There was no discussion of benefits. I was being given something, and it was a gift. And that's how Sister presented it. And that was the end of my interview. And I went home, and I told my husband, I said, you're not going to believe this, but I'm going to work tomorrow. I'm going to the operating room. And he said, we don't even know anything about the operating room. I said, I tried to tell Sister that, but she said it was an opportunity for me. That was the start. When I was in nursing school, I had an excellent OR instructor. Her name was Mrs. Davis. She never gave you busy work. She only taught you what you needed to know, black and white. It's sterile or it isn't. She was just to the point, this is the way it is, and when you took a test, you had to know the exact words because that's how precise she was. And so she gave me my start. because she taught me all the instruments. I had one day of orientation at St. Francis, and they walked me down the hall and told me what rooms they were, and the next day I came in and I was on a case. If I hadn't had Mrs. Dennis, I would have never made it. I did cry a lot that week. I went home and cried because I was pretty overwhelmed with things. I thought about everything Mrs. Dennis taught me, and I made it. Made it 47 years. I would tell them, and I'm going to speak primarily of recovery room, OR, operating room. You have to have communication and work together and help each other. And I think that's what makes good teams, what makes good leadership, is when you can be present and say, I'll help you to open the room, or I'll help you get this patient ready for this procedure. Whatever it is, learn. Communication is the secret, and building your teams and helping each other. You've got to be strong at it. I'm going to say that word opportunity. And that's how Sister Virgilia made me feel, that I had been given a gift coming to St. Francis. Throughout the years as I worked, there were many times that I thought, Dottie, do you know anything about this? And I said, figure out how you're going to learn it, because you're being given an opportunity to bring this health care to this facility, to help guide it and grow it and make us the best. I hope I was a good example to my staff. I set high expectations and I conveyed to them what I expected. Now, there's nothing that I asked them to do that I would not do myself, okay? And I think that's extremely important. There were no shortcuts, and I learned that from Mrs. Davis back in nursing school. No shortcuts in the OR. The ORs at Good Hope, we had two. When I started at St. Francis in '68, we were also the ER. And then when we came out here, and Sister Virgilia thought she was giving us a lot when she gave us 4 operating rooms. She gave us 4 when we moved out here, and now we are at 20. They were very nice rooms, but they were not integrated with the technology and the equipment. We also learned that some surgeons can work very simply with a few things, and others require a lot more, you know, and they're doing the same procedure. You know, we got into stapling the colon together out here. With auto sutures. We didn't even sew the colon. We stapled, we had these staple guns. C.P. McGinney developed a triangulation technique that was published and used throughout the states of how to attach 2 ends of the bowel together using a triangulation procedure. It was quite impressive where we came from. Do you know, when I started at St. Francis, we used glass syringes. We did not have anything disposable. And one of my main jobs that I had, in our instrument sets, we had a little, like a spring, and in it were all our needles. They were reusable needles. I had to check all those needles after cases and make sure there were no burrs on them. And people have no idea what it was like. We washed our gloves. We would wash them and we would check them to make sure there weren't any holes in them. And then we would powder them and re-sterilize them. We made our sterile water. When St. Francis moved from Good Hope to this medical center, it was a huge change. We moved into disposable syringes, wedged-on sutures, disposable drapes. It was a whole new world. We always said the nuns The sisters would have had a fit. When we were in the field and a surgeon would ask for a suture at the old hospital, the circulating nurse or sister, and most of the time it was sister, she'd come up and she'd say, "Let me see how much you got left." You could have an opening like this, and she'd say, "I think you can get another stitch out of that." And she would not give him a suture until he did. When I think of the services that we brought in neural service, we brought in retinal surgery, we brought in robotics, we brought in laparoscopic procedures, we brought in open heart. When you ask me what we gave Cape Girardeau or what, we gave them a really high level of care, and we had excellent physicians and surgeons. And I don't want to downside anesthesia because I have a deep part in my heart for anesthesia because, you know, they're up there and they're really relying on the surgeon doing his part the best. But whatever happens, anesthesia has to be able to handle that situation. And I think St. Francis over the years has been very blessed with the level of anesthesia care as well as the surgeons that we've had. And our teams, they've been outstanding.